Many excellent scientists are contributing to the improvement of scientific exchange between Japan and Germany. I'm honored that the board selected me for this year's JSPS Alumni Club Award 2020 that I gratefully accept. Improving global health is one of the pillars of unmet challenges in the 21st century for Germany, Japan, and worldwide. This year, due to the coronavirus pandemic, health systems are on the brink of collapse, and economies in a recession. We are again reminded that medical research is important on an international scale. German physicians like Belz, as already introduced before, helped to modernize the Japanese health system in the Meiji period. Today, both countries have excellent, up-to-date health systems and medical research facilities. Still, very few physicians are getting their medical or scientific education in Japan and Germany. We should change that. We should open medical schools and scientific institutions to one another. We have established a clinical observer program for German physicians to learn about the daily work of Japanese physicians at the hospital of Juntendo University here in Tokyo. More German physicians should be recruited to this program, and at the same time, we are planning to install a similar program at our German partner medical school, the Charité in Berlin, to invite Japanese physicians to see what German physicians are doing. When talking to German medical students, I noticed that there's also interest to do medical research in Japan. Science is based on mutual trust that only can be established when we know each other. It is one thing to send your scientific CV that indicates your expertise, but personal contacts in the end will drive our actions. I'm thankful for this award because it allows me to visit Germany, to discuss with heads of medical departments and medical science laboratories about the expansion of the medical exchange program between the Charité and Juntendo University, and hopefully many other medical schools. We should set up a joint German-Japanese medical lecture series and ultimately a joint master and doctoral program joined by members of both medical schools. Supporting a mobility program for our health advocates will soon come back to us, as it is us who profit from good medical science and medical care. The aim of university interactions in the field of medicine is to learn from each other and to use each other's resources to tackle diseases. How one disease plays out very differently is best illustrated when we compare the current corona pandemic in Germany and Japan. Patient numbers are very different. Why is that? Is it our genes, our social behavior, our treatments? Bringing physicians and physician scientists from both countries together, we might get answers to these questions. In the introduction, a scientific ambassador was mentioned. What is that? And why I think it might be a position to establish at partner universities. For me, a scientific ambassador is a scientist belonging to a certain country who lives long-term in another country. Scientific ambassadors represent a country on campus. No competition for international offices and embassies. I am known on campus as the female German lab head, as Dr. Heissig. Heissig is the Japanese pronunciation of my last name, Heissig. Heissig is Heidi, the girl of the Alps, of the Swiss Alps. The novel Heidi's Years of Wandering and Learning by Johanna Spyri. I feel honored to be in Heidi's company, as Heidi's courage and willingness to learn makes her a good scientist. But back to my topic. Very soon, the word spread that the German PI on campus supervises and graduates Japanese students. I was soon approached by Japanese students who started considering going to Germany for their postdoc and not to the default choice, the US. Germans, on the other hand, came over to me either to get advice on how to best return to Germany to find a job there, or maybe start a career here in Japan. A scientific ambassador is a living example and should find a place on campuses. Again, it is personal contacts that drive our actions. In agreement with our German partners, we know that an adequate budget will be required to advertise and maintain mobility exchange programs. These programs will widen our horizon, build trust in one another, and surely fruitful scientific collaboration will follow suit. Medical problems require excellent physicians and medical scientists from Japan, Germany, and other parts of the world. We should bring them together. Turning now to my thank yous. Firstly, I would like to thank my family that always gave me the feeling, yes, you can do it, wherever you are in the world. And my mentors, who taught me that results are our guide, but to reach the unknown, we need imagination as our basis. Finally, there's one very special person whom I want to thank, my husband, Koichi Hattori, who, similar to myself, is a physician scientist. We share a love for science and medicine and understand that Germany and Japan have shaped our thinking and behavior in very distinct ways. When we join forces, we can solve big problems. I would like to thank you again for this wonderful encouragement. Thank you.